Gabby, thank you so much for agreeing to chat to me a little bit about your experience with learning Sims online. But before we get there, do you want to tell us a little bit about yourself, where you work, how long you've been a hand therapist?
After I qualified back in '94, I joined Wexham Park Hospital and just did usual rotations. But at that stage, there were only senior therapists working in outpatients and working in hands, and I was really interested in what they were doing. There was no rotation back then. So I used to go in my lunch hours after work, any time I had, just to try to shadow them and see what they were doing. This was really curious, really interested in their work. And then I kind of begged them to come up with a rotation.
That's how I've got to know you, giving so much of your time and volunteering and, pouring your heart and soul into your work so that you can learn. So tell us a little bit about how you became interested in the stiff hand and the Sims technique.
I had a manager at that time who'd worked with Judy Colditz, and she tried to bring the idea of Sims into us. And it wasn't casting with POP, it was with the other kind of casting material they use now. And I remember we did an in-service training on it and we practiced on ourselves. And I just thought, yeah, that's all well and good. I don't really believe it'll work. But I just do what works with my patients. Thank you very much. Mostly doing rheumatology. And I've got some success with thermoplastic repositioning of MCPs, so MCP blocking splints. It wasn't until I had Stephen's case in 2023, where it was a really challenging case, and we had to take things very slowly, very carefully, and I'd rehabbed him to the point where he got some function back. He was able to move the MCPs. We'd worked so hard to get those MCPs moving and get the finger adduction and abduction so that he could stretch on the piano. But he was just really lacking that PIP movement, and his fingers were all fibrosed. And I had obviously maybe attended one of your webinar sessions a while back, and I was on your mailing list. And every so often something would crop up about Sims, and I'd probably just click delete, But for some reason, I clocked it. It was quite recent, and I remembered what my manager back then had said about it as a technique. And I ummed and ahed. It was one of my mornings off, and I thought, what's the harm? I'm not committing here. I can just reach out to her, send her an email, and just ask the question. Do you think this could help? Because I so wanted to help him to play again. So I reached out to you, and I thought, well, maybe you'll get back to me in a week or so. And then within 20 minutes, you were back. I couldn't believe it. And you were saying, you must, tell me more about this case and come and meet people. We're doing a Sims club because we do these sessions monthly where you get people who have learned about Sims, and they come on the forum and we discuss cases. So you invited me to that so I could not present his case at that stage, but to talk about it and to see whether it would be appropriate for him. And I started sort of looking into a little bit more. You were encouraging me to do the course. It was about level 2 as well, which was a bonus. And I thought, yes, why not? Why not stretch myself? It's new learning. It's a technique that'll help myself. It'll help him and others. And certainly wanted to help him do, to achieve the best possible, because I remember in the email I originally sent to you, I said I've hit a brick wall. It's literally a block. I can't, with all the modalities I'm using, I'm not getting anywhere else. So went ahead and did all the learning. So I don't know if you wanted to ask me about the course. I found I could pace it myself. I was very steady learning. It reinforced a lot. It made sense. It wasn't like something you were being tested on. It was out to catch you out. Because, when you have these little tests at the end, I'm always worried about, someone's watching that I didn't quite get it, or that actually it was okay or made sense. And while I was learning, I was able to drip feed that information to Stephen. He being Stephen, was looking up and reading about it himself. He's very academic. And it all made sense to him that, you know, we'd worked so hard to get that MCP movement, get reflection. And it was a kind of, am I going to jeopardize that and end up with a worse situation than we already had? But by the time I'd done all the learning, we were ready to go. He was at the stage saying, well, we've got nothing to lose. I'm really happy to go ahead with this. And at the start of the course, I had already emailed my consultant to say, I'm going to explore this. I just want to let you know in future because, you know, this is going to require casting. And he replied back and said, yeah, why not? I support you with this and I look forward to seeing your results. So that when we actually did that initial first cast and a junior doctor was saying, right, we've got to cut this off. I said, no, you're not. We're doing this technique. And she looked at me quite indignantly. And I said, can you call the consultant in? And he came in and I was able to show him the videos that I'd taken, because with SIMS, you're required to take the photos before and after. The visual evidence is really good for that. And he could see where I'd started. And so he was happy for me to go ahead.
Amazing. Yeah, you touched on a few points there. You know, first of all, it's awareness that grows, and it takes time to become, well, first of all, aware of something and how it can work, but it's usually a case. It's usually one special case that's gripped your heart where you will do anything to help that patient, which was what it was like for Stephen. And I think it is so nice when you are able to feed that information and educate your patient about the technique and they're interested, and then educating your consultant. And you did the right thing, because that's a lot of the problems I have in my mentoring is just trying to overcome objections with the surgeons who don't understand what we're doing and why we're doing it. So well done. You almost did it all, like, simultaneously.
But I just thought it was good to get ahead when the doctors were concerned.
Yeah.
And Stephen kept me updated with, you know, everything going on with his appointments, and so I was able to join him in sessions as well. I mean, with his case, because of the way we pushed at work, I would have found it very difficult to do the SIMS technique within my clinical time at that stage, because I'm learning, it's all very new, and I'm, you know, obviously wanting to make sure I get everything spot on. I must say, the first session, I was playing myself relaxation music, going to the hospital, calm myself down. It was really reassuring having you there mentoring me at the time. So it's like having that person in the room with you, talking it through, and you sort of saying that you need to bring that back a little bit more, or you need to do, you know, you're observing me. A little bit nerve-wracking knowing that you're assessing me at the same time, but I think it worked. It was okay. But I had to, I mean, I'm part-time. I chose to do this in my own time because it was my case study for my art level 2. And then I could give it the time that I wanted to give it, and look out for extra things as well. So although you took me through all the technique, I'd obviously watched the videos that come with the course as well, and reassured Stephen. I said, I've never cast anyone in my life, but I am a good sprinter. I'm very good at handling, so you've got to trust me in this one, which he did. And a little bit nerve-wracking, but we got there with the first cast. So,
yeah.
But then with subsequent casts, I mean, things like I was aware that he had that, not fixed flexion deformity, but that tightness. So I added a TP component onto the cast just to give them a little bit of a stretch at night time. I know you've added in, for instance, K-taping with the cast, and scraping techniques with the cast. All of these things combined really help. So it's not just SIMS in isolation or the casting in isolation, but a combination of things. So.
Exactly. You did a lot of traditional therapy as well. And I mean, you did absolutely everything for that case. And I think it's so rewarding because Stephen became a motivational speaker. I mean, he was a concert pianist and he was able to incorporate a lot of his rehabilitation process and photographs into a PowerPoint slide behind him while he just played the piano. And I think, yeah, it was just a really amazing case to have as your first Sims case. Have you have you done a lot of casting since?
Yes, so while I was still treating Stephen, I had another patient. I mean, my colleagues became aware of what I was doing I was coming in on my days off.
Yeah,
And I was sort of drip feeding them, telling them a little bit about, Stephen's case. They'd obviously seen him in clinic before I did Sims on him. I had a colleague who'd really sort of hit a block with another patient I think he went to sort of tighten up a gas canister and it had an explosion injury into the palm of his hand. And basically, if his hand hadn't been there, he'd been killed the way this thing
wow.
came out. Yeah. So he had tremendous fractures in the palm, but also the way everything exploded. He was left with a really sensitive scar. He couldn't move at all. They tried everything, all the massage techniques and ultrasound and gels, and he was so hypersensitive. And this colleague came and said, I think he might benefit from Sims. Would you take him on? So he was another one I took on. And he didn't quite believe it at the time, but was willing to try anything. And I remember him telling me some of his previous workmates. He wasn't ready to go back to work, obviously, but he'd go in and see his workmates, and they were saying to him, "Did you do that?" Because I thought it was like a DIY job on his. It wasn't as neat as yours, Robyn.
Believe it.
He had two or three casts, and got really good results. I mean, I always remember with Stephen after the first one, we cut it off, and we were going to go and do the next cast, but
Yeah.
Expecting amazing results straight away, and I was really enthusiastic, and I didn't have my notes up from the previous session, so I just took his measurements and said, "Oh, this is really great," and yeah, see you next time. Went home and I was looking and comparing the measurements, and I thought, oh, actually, there's only improvement a few degrees in one joint. Really, it wasn't that great, and I felt really deflated. And but then I thought, no, the tissue felt different.
Yes.
And Stephen had clocked that as well. And I remember saying to you at the time,
Yeah.
I was expecting more, and you said, be patient, it'll come something. And then gradually, with subsequent casts, it just suddenly took off, and
Yeah.
movement, bar one joint that needed hemolysis.
How would you say your philosophy to treatment has changed since learning Sims?
I would say I'm still not going there as a first port of call because of the way our clinics run, the time with patients. But certainly I know it, I've got it as a weapon now, or a modality I can use and bring out. And I'm sort of, my radar is out for those patients who I'm thinking, yes, you're going to do well with that. About 5 more patients I've used it with.
Okay.
I've got 2 ongoing at the moment. So.
And have you found that your colleagues have been interested in learning?
Oh, yes, for sure. Yeah.
What would you say to any therapist who's thinking about doing the Sims online course? Would you say it'd be as good as doing it in person? And yeah, any advice you can give?
Yeah, I don't see why it wouldn't be as good, because usually if you're in person, you're as a group. So maybe you're not getting that feeling of that one-to-one. And I think everything's so organised, the way it's constructed and explained,
Yeah.
You can just sort of do it at your own pace. Yeah, so it's not something that you're going to have to take hours and hours and hours, but you can pace yourself and easily do it when you're still working.
Yeah. And the mentoring helps, the ability to have.
Really helps. Yeah, definitely.
Oh, thank you so much, Gaby. Thank you so much for sharing your experience. And I can definitely say that you and Simon were a gift to me. As much as you learned from me, I learned from both of you. And it really was just a beautiful experience. Your attention to detail, your exquisite presentations to the Sims Club, and just your appetite for learning. And I know that we've got a long learning journey ahead with so many more things to come.